This is Rogers TV, Barrie.
Here to provide you with the COVID-19 update for Simcoe Muskoka. So the last time I reported was on September the 15th. That's 3 weeks. And in that interval, we've had a total of 352 cases. So we're now up to a cumulative total of 13,595 cases. Just a reminder, if people could please mute their line, I could hear a bit of background. Thank you. And so far this week, since the weekend, we've had 52 cases from October the 3rd onward. So we've actually had 4 weeks of declining cases. And certainly this is very good news. Since the week of the past week, we've had a 10% reduction in cases. So during the past week, we had 97 cases compared with 108 cases the week before. And if you go back to the week of August the 29th, we had a total of 203 cases in that week. So we're down to less than half of the case count from 4 weeks ago. And the province over the past week has had a 10% reduction in cases as well. So we're following a similar pattern to the province. We have 131 active cases, which is down from 250 cases on when I reported 3 weeks ago on September the 15th. And we've had 5 additional deaths over that 3-week period. I would like to express my condolences to the family members for your loss. So this consists of 3 women and 2 men, all between the ages of 40 and into their 60s, and all from Simcoe County, none immunized. And I would also like to acknowledge that we have been made aware of a youth who passed away suddenly. And I would very much like to express my condolences to the family for your loss. This is truly very sad. And this individual had received a dose of vaccination more than a month before passing away. And there was nothing in the history or medical record to suggest an adverse reaction of significance or myocarditis, despite what may be portrayed on social media. We are following with the Chief Coroner's Office in that investigation. It will take several weeks to complete the investigation. An autopsy has been performed, and there's nothing in the investigation to date to suggest that there was a causal association between that person having received immunization and his unfortunate passing. But if in fact we learn something different with regards to that, we certainly would communicate that to the public. But I think at this time, I would certainly like to reiterate my condolences to the family members. Such a sad thing to have a young person pass away suddenly like this. This is a rare event that does occasionally, rarely happen. And the investigations that are required to help determine exactly what happened are taking place. Otherwise, would urge that people respect the need and the right of this family for their privacy. So currently in Simcoe Muskoka, we have 6 individuals from Simcoe Muskoka who are hospitalized, and this is down from 13 when I last reported, and 4 in the intensive care unit, down from 6 when I last reported. And their ages range from their 20s to their 60s, and 50% of them are below the age of 60. 5 acquired their infection from the community, and 1 as part of an outbreak. And none of them had a record of immunization. Today, we've had 19 cases reported in the last 24 hours. 16 are sporadic and 3 are outbreak related. 8 of them are male, 11 female. 14 out of the 19 were under the age of 50, and 7 out of the 19 were children under the ages of 18, all in Simcoe County. With regards to acquisition, 6 are under investigation, 5 are close contacts of a case, 3 are community acquired, 3 are related to outbreaks, and 2 are related to travel. All are self-isolating. And of these individuals, 4 were fully immunized, 9 had no record of immunization, and 6 were not eligible due to their age to be immunized. Most of our active cases have been in Barrie and in South Simcoe, which has been the case throughout the pandemic. During the past week, New Tecumseh had the highest weekly incidence of 45 cases per 100,000 population, followed by Bradford, West Gwillimbury at 39 cases per 100,000 population for the week. Overall in Simcoe, Muskoka, our incidence is 16 cases per 100,000 population per week, which is 10% lower than the previous week and lower than the provincial rate at 27 cases per 100,000 population per week. So we are pulling away from the provincial rate. Over a month ago, we were very close to the provincial rate. So we find ourselves back below the provincial incidence, which is where we've been throughout most of the pandemic. We do note that a large proportion of the cases are in children under the age of 12, children who cannot be immunized. So it's now up to 31% of our cases over the past week. And the majority of those are actually school-age children between the ages of 4 and 11. Community-acquired cases make up 1/3 of our cases. So these are cases in which we don't know how acquisition happened, and therefore it was deemed to be through casual contact in the community. And this is up from what it had been earlier in the pandemic, between 20 and 25% of cases at that time. 100% of our cases in the past week were due to the Delta variant, in keeping with the situation across the province. We have 5 ongoing outbreaks, which is unchanged from the past week. This includes an outbreak in a congregate setting in Simcoe County, and an outbreak in a school in Simcoe County, a newly reported outbreak in 3 schools in Simcoe County, and 3 outbreaks declared over the past week. 1, a childcare center in Simcoe County, and 2 in schools in Simcoe County. So we've had, since the beginning of this school season, a total of 8 confirmed outbreaks in schools, all of them elementary schools, not secondary schools. And 4 of them are over and 4 of them are ongoing. And all of them have been in students. So we continue immunization. And at this point, 85% of those in Simcoe County who are turning 12 or older have received 1 dose of immunization, and 80% have received 2 doses of immunization. And the provincial target is 90 doses for dose 1 and dose 2. So we continue making progress on that. When we look at transmission, we find that the risk of becoming a case of COVID-19 is 11 times higher in Simcoe Muskoka for those who are not fully immunized versus those who are fully immunized. And in terms of hospitalization, the risk is 40 times higher for those not fully immunized versus those who are fully immunized. This is data from August the 8th to October the 2nd, local data Simcoe Muskoka. We continue to need to make progress with regards to immunization of young adults, in particular, young men in particular, who have the lowest rate of two-dose coverage at 65.6%. Youth are higher at 74.6% for two doses, and other age groups are all above 70%. Those that are 16 above are well above 90% two-dose coverage. So making progress, but need to continue to make progress. When we look at vaccination, breakthrough cases, so we look at those who are cases, how many were immunized. 28% of the cases that occurred in the week of September the 26th were among people who are fully immunized. So the rest were among people who were unimmunized or partially immunized. Okay. We have hosted 18 vaccination clinics in schools in this present school year, and 44% of the doses given to date have been among people receiving their first dose. So we've given so far a total of 2,177 doses at those clinics. And 38% of those were among school-age children, and 53% were among males. So we do need uptake, particularly among young men and youth males, in that they don't have as high a coverage as females. With regards to our dashboard, we remain in yellow status. Yellow status for viral spread, and green status for turnaround time and laboratory testing, and yellow status for health system capacity. This is due to some increase in hospital bed occupancy. However, this is not related to COVID-19. It would be due to other factors. And the public health system capacity still remains in red, though we have improved in our turnaround time for contacting cases within 1 day. So we're up to 76% of our new cases being reached within a day, compared with 70% a week ago. Okay. Our percent positivity is improved slightly at 0.9% compared with 1.1% last week. So lower is better. And actually, that would be for Simcoe County. Muskoka is slightly higher at 1.7% compared with 1.8% a week ago. So Simcoe Muskoka overall is 1%, similar to what it had been a week ago. And Ontario is 1.9%, similar to what it had been a week ago. So we're doing better than the province and stable. Okay, so a few comments from our media notes. We have seen some school-based outbreaks, and they have been occurring in younger children, not in high school. So this really speaks to the importance of immunization. We're, I think, seeing the benefit of immunization in youth, including those in high school. But younger children cannot yet be immunized. So it's very important that all the control measures that we have in place for primary and secondary school be implemented. And this does mean screening your children before they go to school, and even screening for their symptoms on weekends as well, and holding them from going to school if they have any symptoms, and seeking assessment and testing. And in that situation, while you're awaiting outcomes, you shouldn't be sending your other children to school either, unless they are fully immunized. And of course, everybody needs to be screened for symptoms. So fully immunized children who have symptoms also need to be withheld from attending school. And of course, this applies to those who work in schools as well. We also want to reiterate again the importance of vaccination where you can for yourself and for your children. If you are vaccinated, you're helping to protect your child if they are unable to be immunized because of age. So another point that I'd like to reiterate. And we do have information about the protection of children going to school on our website. Of course, there are the other requirements as well, such as the masking and sticking to the cohorts in the school environment that they're assigned to in their class. The province has announced the availability of rapid antigen testing for the school setting, not to be applied universally, but to be applied at the determination of the local medical officer of health. And we are to take into consideration risk applied to the community, risk factors, and risk factors applied to the schools in question. And the main objective is to allow schools to continue to be open when otherwise it would be possible that they would need to be closed. So in an outbreak setting, for example, in a school, if I determine that it would be helpful to do rapid antigen testing among the children attending that school who aren't deemed to be immediate high-risk contacts, and those who aren't immunized, in order to help with another level of protection and more information to be better assured that there aren't other cases that we're missing, that this would be an option for us as medical officers of health to pursue and to advise the school board in question or the schools in question when we determine that this would be helpful. So this would be in keeping with recent reporting from the Ontario COVID Science Advisory Table and Public Health Ontario and the Ontario Testing Strategy Expert Panel. So not meant to be universally applied, meant to be focused where we would deem it would be helpful for a particularly high-risk situation. And meant to help keep our schools open and keep children able to attend school where otherwise we might not be able to do that. And this could also be applied to daycare centers as well, same kind of approach. And this shouldn't be confused with the investigative testing that's done using a different type of testing, PCR testing for children who have had a high-risk contact with a case or who have symptoms. That's a different approach altogether. The people in question are definitely going to be identified and contacted by public health to arrange for the testing of their contacts. And if you're developing symptoms, you need to go to an assessment center, take your child to an assessment center to be investigated and tested with the PCR testing. So just want to keep those two distinct in our minds. PCR testing has already been in place for a long time, and it's for the investigation of people with symptoms and those who've had a high-risk contact with a case. As opposed to this new approach the province has just made available as an addition for medical officers of health to use where we feel it's possibly helpful with rapid antigen testing for others who don't fall into the category of symptoms or high-risk contacts, others in the school environment to help keep a school open or a daycare center open. And we would be advising on this rather than something that you would need to reach out about or ask about. This is something we would be advising the school or the daycare center about. We do have upcoming celebrations and gatherings. So Thanksgiving is coming up, and the province will be releasing guidelines on how to operate safely for these events. And that will be announced tomorrow. However, what I would position is there's certain approaches to keep in mind. Attendance remotely is one possibility. The safest outdoor gatherings are safer than indoors. Remember the gathering limits of no more than 100 people outdoors and 25 people indoors. People should be self-screening for symptoms and not attend events like that if they have symptoms. Those who organize or host these events should remind people of that. Those who are fully immunized are safer with regards to gathering, in a particular indoor gathering. And so this is yet another good reason for people to seek out immunization, either for what's coming up immediately, but other events, gatherings that are coming up through the fall season, yet another good reason to be immunized. For those that are gathering indoors, masking and distancing is always safer, and really would only be recommending considering not wearing a mask, not distancing if everybody present are fully immunized. If people aren't fully immunized, or if you just don't feel safe about it, then distancing and masking is definitely preferred and safer. And it's always good to keep in mind outdoors safer than indoors. And people need to abide by the gathering limits of 25 people, no more than 25 people indoors, no more than 100 outdoors. And hand sanitization, sanitization of surfaces is good. Increasing airflow, open windows can help gain some of the advantage of being outside, even if you're in. So on September the 29th, the Chief Medical Officer of Health announced the provincial government's preferential recommendation of Pfizer vaccine for people 18 to 24 years of age, in that the incidence of myocarditis or pericarditis has been found to be somewhat higher for those age groups if they receive Moderna vaccine. So Pfizer vaccine having a lower incidence of those conditions compared with Moderna. And so this is a precautionary piece of advice, and therefore we're reiterating that with regards to the immunization we provide at our clinics. The National Advisory Committee of Immunization has just put out recommendations about booster doses of mRNA vaccine to residents in long-term care facilities and seniors living in congregate settings. And the recommendation is that a third dose, a booster dose, be provided at 6 months post the second dose. This is also in keeping with recommendations from the science table. The province right now has been providing, through health units, immunization to residents in long-term care facilities and high-risk retirement homes and elder lodges at an interval of 5 months post the second dose. So we await further direction from the province as to whether or not they would change that to align with the 6 month interval advised by the National Advisory Committee on Immunizations. Certainly very important for others entering these facilities to be immunized. Healthcare workers now to be required to do so, except if they have a medical exemption. But visitors and relatives, et cetera, really to help protect those that are at these In these settings, we advise that you would be immunized. We advise all people turning 12 and above who don't have a medical exemption to be immunized for many reasons, but this would be yet another very good reason to be immunized. So we continue with our vaccination clinics, and we post on our website where people can go to get information about our vaccination clinics, pop-up clinics. And we would also say that people will be able to continue receiving immunization at pharmacies that are participating and primary care offices that are participating, and can make appointments on a limited basis at our health unit offices. So please connect with our website about that. So at this point, I think I have one more media question that I'll address. With the possibility of a vaccine approved for use in younger children before the end of the year and potentially by the end of the month, is the health unit ready to go with a plan to vaccinate younger children? Would that be done through school clinics? So we are actively working, preparing with primary care, with community pharmacies, with our school boards for multiple modalities or locations where children would be able to get immunized at those locations, and at clinics that we would establish as well. So we are planning some community-based clinics in locations throughout our region. And some of these will be located at schools in the evening and on weekends. So we do want to allow for multiple ways by which parents would be able to take their children to get immunized. And of course, we await the authorization for this from Health Canada and direction on this from the province. So this is merely planning at this point. So at this point, I'd be happy to take questions.
Thank you so much for your update today, Dr. Gardner. We will now take some questions from the media. As always, we do ask that you kindly limit yourself to one question and one follow-up in consideration of time. Can we start today with Mary Beth Hartle from Muskoka Region? Do you have a question?
No, actually, I'm good today. Thank you.
Thanks, Mary Beth. James Bowler from Cogeco, do you have a question today? Okay, thank you. Mark Claremont from Muskoka Today, do you have a question?
Yeah, thanks very much. Regarding rapid tests, Dr. Gardner, are you recommending any for Simcoe Muskoka?
We certainly are looking at under what conditions we would recommend it. At this point in time, we aren't recommending any particular school undergo such testing, but we're carefully considering when we would do so, if we would do so, and when we would do so.
So none now that are on? Yeah.
None now.
Yeah. So the other question is, so around the world, there seems to be a new feeling or understanding that there, and hesitate to call it acquiescing or anything like that, but people are believing that this is going to be longer than they predicted, the pandemic. Do you have any plans to handle that in the long term regarding testing and vaccinations? And do you have enough vaccines currently and going ahead?
So vaccine supply is the responsibility of Health Canada and the province, and the supply is plentiful at this time, more than we would need. When it comes to the immunization of children, we await information about what the formulation would be, and it may be that the supply at the very beginning is limited, and we'd have to prioritize based on criteria that the province would give us. So we just have to wait and see what that looks like. Certainly for adults, we don't foresee a shortage of vaccine. There's a potential for more booster recommendations to come, but for now, we don't have that. We are doing some planning towards additional booster doses for other segments of the population, but I don't anticipate a shortage of supply. We do need to be prepared as to how it will all be delivered. And that does take resources, including health unit resources and partners. It therefore means that we will continue to be very busy responding to the pandemic, not just case and contact management, not just enforcement and education, but also immunization. We also want to commence more of our broader mandates. So we've started that with child vaccinations. We want to be able to continue to do catch up on child vaccinations. And we do know that there are some real pressing needs in the community to be addressed. So substance use and opioids is a pressing public health need. The mortality from opioids went up quite substantially through the pandemic. We maintain some activity on that, but we do need to do more to address matters of that nature. We're well aware of the mental health impact of the situation, and we do need to be supportive of a response to mental health needs. It's entirely true that we could be seeing pandemic activity around the world for years because a very high degree of vaccination would be required in all countries to truly bring this under control in the near future. And although there has been some reporting of a call for immunization around the world, that's certainly a front that needs advancement. So I think we need to be thinking in terms of the pandemic continuing for years. We are making progress in controlling it here in Ontario, here in Canada, but we do need to be mindful of the potential for new variants to arise that could impact on us. The pandemic is still a major task for us going into the future to manage, and another major task for us is to otherwise recover as a public health sector to be able to do our broad mandate and protect the public from all kinds of health challenges beyond COVID-19.
Great. Thank you very much there.
You're welcome.
Chris Simon from the Barrie Advance, do you have a question?
I always do. Hi, Dr. Gardner. I'm going to try and squeeze a bit into this question, so bear with me here. But can you touch on what the focus in terms of vaccinations are now for the health unit? Are there particular geographical areas? Are there particular segments of the population other than young men, as you touched on earlier, that you're trying to reach? You know, we've seen the data in terms of race, socioeconomic vaccinations, but I'd be interested to hear where you guys are going now.
We are focusing our pop-up clinic locations based on lower coverage geographically by postal code, forward sortation area, and otherwise want to make it available to young men in particular and to youth. And so there's a focus there on school as a segment. We find, we're also pushed very hard to get the booster doses to long-term care and the high-risk retirement homes. So that was a push for us as well. I think we need to continue with the final mile, which is slow progress, but we need to continue it to edge up the coverage. I think it's very much in my mind is we have some control of the Delta wave right now. We don't want to lose control of the Delta wave. and we want to keep it coming down and not surging back up again. The Science Table put out a report at the end of September that suggested the possibility of an increase that could come later in the fall, early winter. That it's a precarious balance we have right now. So we do need to edge up immunization as a key strategy to deal with that. And we do need to be prepared for the additional booster doses that the province and the National Advisory Committee on Immunization would recommend coming down the road. And we do need to be ready for the immunization of children coming down the road. So I think I've given you more than one priority there, but the bottom line is to make movement across the board for coverage.
Yeah, I'm just wondering whether there are any municipalities like you see first and second dose coverage, and it varies from like municipality to municipality. I'm sure neighborhood to neighborhood to a certain extent. Yeah. Wondering whether there's anywhere that you guys are falling short that that maybe you think you should be targeting right now.
We note certain forward sortation areas, postal code areas. So certain ones in Barrie, for example, certain locations in Muskoka, certain locations in northern and southern Simcoe. So they vary geographically, and we do our best to target them.
And if I can also just ask one more question, there's been lots of talk about municipal employee vaccination rates. What does the health unit's vaccination rate look like among staff?
So our deadline for submission of vaccination status in our policy is the 8th of October, and we'll have definitive information going into next week about it. At the beginning of this week, we had over 80% of our staff having submitted their data to date, so almost a week before it was due. But that's not the final answer. The final answer will come after the 8th.
Sorry, and how many employees are there at the health unit right now?
I'm going to get an exact figure for you and get back to you, because it's certainly much bigger than the original 280 FTEs that we had before the pandemic. It's been in flux. It had doubled at the height of our mass immunization clinics. We've had a certain number of positions end. So I'm going to get an exact figure for you.
Awesome. Thank you very much.
Okay.
Thanks, Chris. Mike Arcelides from CTV, do you have a question today?
Yes, Doctor, welcome back.
Thank you.
If we can go back to the unfortunate passing of that youth, did that youth have COVID-19?
We have no evidence that that youth had COVID-19.
So the mentioning of this, strictly to clear the air on any misconceptions that might be out there with regard to the possibility of a vaccine-related adverse effect? Yes,
there was some social media play positioning that this individual had developed symptoms and had been very ill shortly after having received their vaccination. And in fact, that was not the case when we looked at the documented medical record on this individual. There had been no reported adverse event following immunization, and no hospital admission, and it had been more than a month after the administration of their one dose of vaccine that they had their tragic sudden death.
I can switch gears if that's okay, Kara. With regard to that school in Bradford, St. Marie of the Incarnation, there's more than a dozen cases there. At what extent and at what point do we decide, you know what, let's take a break for 2 weeks at school, or let's get rapid tests in there? Is there a threshold that you're setting in your mind?
So far, we've got, I think, a pretty good handle on the nature of the where it's clustered and who's involved. So it's either clustered, within, a certain cohort, or otherwise siblings for those that were from that particular cohort. So we don't feel it's necessary to close the school, and we want to do everything we can to keep the school open. And so far, we're using the more traditional approach of identifying the contacts, isolating them from school, and having them tested using PCR, which is much more sensitive as a test than the rapid antigen test. And at this point in time, we haven't chosen to use the rapid antigen testing. If we did, it can't be done before the release of this on the Thanksgiving weekend. So it's something for us to consider, but at this point, we're not doing it.
Okay, thank you.
You're welcome.
Erica Engel from Collingwood Today. Do you have a question for Dr. Gardner?
The Prime Minister announced today that it would be mandatory for people who are using trains or planes to be vaccinated. Just wondering, and that's effective end of November. Just wondering if you had any comments on that new policy from the federal government.
Well, that would be in addition to vaccine mandates that already exist. We already have the requirement for proof of immunization to access non-essential services in the province of Ontario, and the requirement for vaccination to work in certain healthcare settings or provide certain community and social services. And many medical officers of health have advised that all employers create vaccination policies for their workers. And I've done that as well, given that advice. A number of municipalities are pursuing that. All of that is for the purpose of reducing transmission in those environments and encouraging people to become immunized and helping to keep those businesses and services open and operating. When you have outbreaks in those settings, it can be very disruptive and lead to a shutting down of those services. So this would be the same kind of approach, expanded into other public settings, those travel-related settings. And those are settings where you can get close contact between people that could conceivably lead to transmission. So I would say that this is an approach that's consistent with what's already being done.
So you have commented previously that policy is really important for increasing the rate of vaccination. And I just wondered how you feel as a medical officer of health that so much policy has ultimately had to be implemented to get the vaccination rates even to where we are today and higher. Wouldn't it have been better if people just did it enough without policies being set?
Well, ideally, we would prefer that people would simply want to get immunized. There are many people who want to get immunized, but have barriers to getting immunized. So we certainly need to do all that we can on the supply side to help. But there are also people who, they're not necessarily opposed, but they lack motivation, sufficient motivation to get immunized. So having policy helps address that. It probably won't change the minds for those who are truly opposed. So policy, for the most part, works for those who have some reluctance, some hesitancy, or some complacency. It helps to motivate them to get immunized. Without policy, we still manage to provide full immunization for 3/4 of the eligible population based on age. So most people were very willing, very happy to receive immunization without that kind of policy approach. But to get to the final mile of very high coverage, we've needed policy. And we knew that it would take that at the end to get you up to the level where we really do have stability and herd immunity. And this is such a transmissible variant that we do need a very high vaccination coverage.
Okay, and one quick follow-up, if I may. I actually got a call from someone I think at the provincial vaccine booking place, just saying if you haven't already booked one, encouraging you to book it, or if you have questions, call the health unit. Are they just sort of calling everyone for you, or do you know how that's working?
So my understanding is that they are contacting individuals who haven't received immunization, who are eligible, who don't have a family primary care provider. They've also provided the names and contact information for people who are rostered with primary care, provided that information to those providers for them to also reach out to those individuals. So if you received a call directly from the province, it probably would have been related to the former group, the group that hasn't been immunized and doesn't have a provider.
Just to clear the air, I did get vaccinated. Not sure why I got the call.
Yeah, and I'm glad you did. That's great to hear. And if that's the case, I'm not really sure why you received a call.
Oh, well. Thank you.
You're welcome.
Thank you, Erica. Can we go over to the phone line? Do we have any questions today?
Hi there, it's Ian from Barrie 360.
Hi, Ian.
Good afternoon, doctor. I'm just wondering, going back to the death of that young man, you indicated he'd received a dose of vaccination. Do you know what type of vaccine he received?
It was Pfizer.
It was Pfizer? This was only his first dose, or this person's first dose?
First dose.
And
more,
you have...
more than a month?
Right.
Before his passing.
And you mentioned some adverse reaction portrayed on social media. I don't know if you're going into
but no significant or severe adverse reaction in his medical record.
Okay, thank you.
You're welcome.
Are there any other questions from the phone line?
Hi there, it's Adrienne. Dr. Gardner, I just have a quick question about the rate of infection. The rate in this area has been leading downward, and I just want to know if there's, I guess, one thing that can be attributed to, or if it's a combination of things, and just how you see things.
I would say that it's in keeping with the provincial trend, that we are lower than the province, but we've been lower than the province for most of the pandemic, so it's still in keeping with that pattern. I would say that we don't truly understand why we've been successful. We've achieved a high vaccination rate, and I have no doubt that that's a major contributor to it. We're still seeing transmission happening among the unvaccinated, primarily, including young children. So no doubt our vaccination coverage is a major contributor to this. We did maintain mask use and capacity limits to some degree, and physical distancing and gathering limits. And I feel that that's a contributor. Perhaps the good weather enabling us to be outdoors for interaction has been a contributor. But I cannot definitively say why. And so I think that we need to continue being cautious. Because of that, we have the entirety of the fall and the winter ahead of us to manage.
Okay, I think that's all I've got. Thank you.
You're welcome.
Is there anyone who hasn't had the opportunity to ask their question this afternoon?
Can Mike Arcides ask one more, please?
Sure, go ahead, Mike.
Doctor, your former colleague down in York Region, Dr. Kurji, now retired, hinted at maybe we're seeing, because things are looking very sporadic with cases, that this could be a sign of herd immunity. Do you share that belief?
It's possible that we're getting there. I've participated in some discussions with colleagues, including at the science table, where perhaps we're at the point where every additional percentage increase in coverage is tipping us much more and more in the right direction, that we're sort of teetering on the edge of getting there. And as I've indicated, I have no doubt that the high vaccination rate is a major contributor to the success we're seeing. But I think we still need to be careful. I still think that the other control measures are needed. I think that we certainly want to avoid any kind of resurgence or the kind of experience that's happened in Western Canada.
Are there any further questions this afternoon for Dr. Gardner? Okay. Well, thank you so much, Dr. Gardner, for your update today. And thank you so much to our members of the media for your participation. Our next media briefing will be Wednesday, October 13th. Thank you so much.
Goodbye, everybody.
Recording stopped.
Stylists, new stylists, parents of Black youth and Black people learn how to take care of their hair, learn about ethnic hair, kinky coily curls, afros, how to style, how to lock, and how to make sure that the hairstyling industry is no longer segregated. It's like the last segregated industry. And it seems to be okay for there to be white salons and Black salons. And I would love to see that change. And for if somebody's a stylist, you should be able to never have to turn away anybody from servicing them. It should be an inclusive environment, and it should be a safe environment. So we talk in that platform, we're talking about how to create a safe environment through healthy and safe conversation in the salon. How not to speak to your Black client about their hair, right? So things like that. So an all inclusive program. So lots on the go, lots happening. We need a lot of support to make it happen.
What has the reception been like? How are people receiving up to this?
Yeah. I think there is a mixed reception. Some people are like, "Oh my God, we've needed this. How come we didn't even realize until it happened how badly we needed it?" And then the other one is this idea that it's not inclusive because we're supporting the Black community, but it's the same as like the Barrie Native Friendship Center or any friendship center or or any LGTB organizations that are servicing those communities. The idea is to offer these people who normally don't have support services, don't have a voice, don't have visibility, don't have community, giving them a space to feel safe, that they can speak about their experiences in a place that they know.